Okay, hi, it's Dr. Buford. We're just getting started on the left shoulder. We're looking at from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. Right off the bat, we can see the biceps tendon on the right side of this gray cannula. We can confirm the biceps anchor problem. So here is the biceps anchor problem right here. This is what we call a slap lesion. See that? Okay, you can see the edges of it, how unstable it is in this part of the labrum. And we can see how that is loose when we tug on the biceps. Okay, so this is the issue with a slap lesion that doesn't get better with time. It's usually because it looks like this and it's unstable and causes pain. As we look towards the back of the shoulder, we can see some general labral tearing down here. That's also technically a labral tear, but you can see that it's in a different part of your shoulder. This is down at the inferior aspect. And because you're laying on your side, this would be kind of the 6 o'clock point on the clock face at the bottom of your shoulder. We're going to put our shaver in here, and we're going to shave this labrum because this is not a repairable injury right here, and it's not a detachment like somebody would have from a dislocating or unstable shoulder. Hold tight on that. And so as we maneuver over here, we're going to put our shaver in, turn on a little bit of suction, and we can debride this labral tear pretty quickly while trying to protect the cartilage. So we'll push in the, come over here. Yeah, hold that down. Okay. We'll hold that tight, and again, we'll just use the shaver here just to debride this labrum a little bit so that it's not pinching in the joint. Seeing here, this is really more of a degenerative problem because again, there's no real history of instability to worry about here. And arthroscopically, we can look at the posterior capsule. We can see that there's no injury here. We can see that there's really no signs of laxity under the microscope, just this degenerative labral tear posteriorly. Okay, and so we'll stop there. Now we'll look at the anterior labrum here. And it, for the most part, looks all right. I don't see anything that's significantly loose that's going to cause a problem in the joint. Okay, so we'll show you some more in just a minute. Now we're back dealing with this labral tear that's part of the slap lesion. This area here, we're going to pass a needle through the biceps tendon. So our first pass goes through just like that. Basically we're spearing it. Control that for a second. And now through that needle we're going to pass a black wire called the super shuttle to the wire just like this. Now as we pull back, you'll see how we use that wire to shuttle a stitch through the biceps. And now we're going to repeat the process one more time to give us a type of purse string or hitching type of suture going all the way around. So we're going to come through the biceps one more time, just like that. We're going to feed the wire again one more time. The wire through the second time, and now here's the trick for what we do. Hold the camera here. We're going to sneak around behind the biceps this time to retrieve the wire. So see how we come around the back? And now we'll pull the wire through. Pause. Now we have a stitch that goes all the way around the biceps as you see there, and that's a real strong stitch. So now we can take a pair of scissors and we can release the biceps at its base here, and this will take all the pressure off this labrum and make it so that this problem cannot come back. Okay, so there we go there. So now the biceps is released. We don't have to really do much to the labrum at this point because the deforming force, the biceps tendon that was causing this, is now gone. We do want to clean up a little bit so there's nothing that can cause any symptoms, and that's what we're doing right now. But rarely do we have to, hold the camera here please, steady. Rarely do we have to secure the superior labrum after releasing the biceps tendon. So that already looks a lot better. Biceps is up there. Inside the joint, here's the rotator cuff up above, and it looks great. We can see how the tendon's inserting right along the edge of the articular cartilage, all the way up to the rotator interval here, and then all the way to the back. We can see the infraspinatus looks fine. We can look down the front, we can see the superior edge of the subscapularis poking through right there. So I don't think there's anything else to worry about inside the joint. What you here is we're just tying the final suture to secure the biceps tendon. That's now tied. You can see it's over the rotator cuff tendon, kind of in situ in the groove. And now we'll clip the suture. And we'll give you the overall look. We've already done a decompression. So the acromion is at the top of the screen. This is nice and flat now. That's the end of the clavicle right there. This is the muscle of the supraspinatus. And anteriorly here, of course, is where we're going to find the biceps tendon, and there's the tenodesis. Okay, so as we rotate, that all moves together as a unit. That looks solid. Your rotator cuff on this side looks great. No signs of any problems. There was a fair amount of synovitis or inflammatory tissue. We've taken that all away. And so I really hope this does the trick for you, okay? Good luck to you now. Bye-bye.